everybody. My name is Christopher Graham. I am an LCSW and a board-approved supervisor. I'm extremely excited to do a brand new series, so I'm going to actually go over some pocket prep questions that are really common. One of the favorite software that I use and I encourage people to use when they're studying is Pocket Prep. It's really reasonably priced. They're not sponsoring anything, but some of the questions that we're going to come across are not what you would see on the test. When you're discussing questions and studying and test prep, don't focus on the exact content of the question. That's not what this is trying to teach you. You're not going to learn how to be a clinical social worker based on what exists inside of a practice test. But what you are going to want to learn is how to answer questions. How do you break down questions? What questions are relevant for your studying? Maybe what you need to focus on, perhaps, but really the main purpose is to identify modifiers, qualifiers, and break down a question to find the answer. When it comes to any clinical test, you're going to find that you have 4 right answers. And so when you go to take the test and you try to find the answers, each answer is going to sound right. What we want to do is we want to uncover which is the rightest answer. What is the best answer for the question? I want to break down what it is that I'm seeing specifically in these questions as a supervisor. So what would I do with this question? Which form of family therapy provides an opportunity to gain a mutual understanding by exchanging ideas, role-playing, and enacting psychodramas? This is not going to be a test question. This might be an LMSW question, but it's not going to be a question that you would typically see on the LCSW exam. And the reason I'm saying that is this is a regurgitation question. Most of the questions, 85% or more of the questions that you're going to find on the ASWB LCSW exam are going to have modifiers. They're going to be case vignettes, and it's going to try and see not just do you know what this treatment is, but do you know as this type of a therapist how to enact this treatment, how to get the best results using this treatment. So when the ASWB asks you about therapy, it's going to tell you what type of therapist you are, what kind of client you have, and what's the situation surrounding that. When they ask those types of questions, they're asking as if you are the most ethical, the most knowledgeable, the most informed clinician that ever existed in that field. If it says that you are a marriage therapist, a sex therapist, a behavioralist, or you're an equine therapist, it doesn't matter. When the question asks you specifically in a vignette what you're doing and what you should do, the best answer is going to assume that you know everything about that field, even if you don't. It doesn't care about your own personal experience or your own clinical experience. So this question right here, whether right or wrong or indifferent, this is an LMSW question. This is typically not going to be on your LCSW exam.